Okay.
I don't know about Gingell,
Here.
Gershenson,
Here.
Jackson,
Thank you.
here. McGilvray is absent with notice. Nelson,
Here.
Cavell.
Here.
Joliet,
Here.
Lubes.
Here,
We have a quorum.
thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is approving the minutes from June 6, 2023. I have a motion by Commissioner Nelson, support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? The minutes are approved. The next item is approving our agenda. I have a motion by Commissioner Gershenson, support from Commissioner Jackson. All in favor say aye.
Aye.
Opposed? Our agenda is approved. We've arrived at our first public comment. Is there anyone from the public wishing to comment on items on the agenda? Public comment is closed. We move to communications. There are 5 items under communications: an amendment to the fiscal year 2023 Access and Visitation Grant. The second item is our animal shelter intake disposition report. The third item is from our Oakland Together Mental Health and Wellbeing Nonprofit Grant Program. The fourth is an application to the Michigan Fitness Foundation. And the last item is from the Haven, the Safe Therapeutic Assault Response Team Program Quarterly Report. Anybody want to make a motion to accept communications? Commissioner Jackson, supported by Commissioner Cavell. Any comments or questions on communications? Commissioner Cavell?
I just want to mention that if you look at the Haven quarterly report, they have had an increase in patients from 54 between the last quarter of last year to now at 79 in the April to June quarter. So the need is growing.
Thank you. Any other comments? All right, we prompt the vote, please.
You have 7 yeas, 0 nays.
All right, motion carries, thank you. Our next item is from Area Agency on Aging 1B, the recommendations for their fiscal year 2024 annual implementation plan. And we do have Katie Wendell here virtually to speak to this. We just need a motion to receive and file afterwards.
No vote. It's a recommended board
Okay,
on the plan.
okay. Okay, all right, welcome.
Good morning, and thank you so much for having me today. My name is Katie Wendell. I'm the Director of Planning and Advocacy at the Area Agency on Aging 1B. Had the pleasure of working with many of you before in different contexts, so appreciate the opportunity to present to you today. The Area Agency on Aging 1B is one of 620 area agencies on aging throughout the country and one of 16 in the state of Michigan designated by Congress and the state legislature to provide information, advocacy, and services to older adults, which we define as individuals over the age of 60, and their family caregivers. We are here to serve the more than 800,000 older adults who live in the 6-county region of Southeast Michigan that we serve, which includes almost 30% of the state's total senior population, with more than 326,000 older Oakland County residents. We generally call these programs Older Americans Act programs, and they're funded with federal Older Americans Act funding, state Older Michiganians Act funding, and of course, your local county match. Today, I'm presenting for your approval our annual implementation plan for fiscal year 2024, which begins on October 1st. This is year 2 of our 3-year multi-year plan, which ranges from fiscal year 2023 to 2025. This plan really serves as an update to that 3-year plan, which was approved last year by this body. And there have been no substantial changes to our service mix laid out in this plan for fiscal year 2024. Our board of directors approved this plan at their meeting on June 23rd. And this plan is designed to meet requirements presented to us by the state Bureau of Aging and Community Living Supports, or ACLS. It outlines our plans for spending federal and state funds, excluding Medicaid, which we do have substantial Medicaid programs, but those aren't part of this plan. And we will continue to update our plans annually. Following our approvals from the 6 counties that we serve, we'll seek approval from the State Commission on Services to the Aging in August. The community really drives what we do in providing programs and services. Decisions in the plan are made with ongoing input from stakeholders, including our provider partners. In May, we hosted a public hearing to gather feedback on the plan. And the plan outlines how we'll spend about $24 million in federal and state funds. And we spend those funds in 2 ways in the community. We grant awards to community organizations through a competitive RFP process. So in Oakland County, that funds services such as Meals on Wheels, grandparents raising grandchildren support, and legal services for older adults and family caregivers. We also administer some access and in-home service programs ourselves. So the Area Agency on Aging 1B has a call center where individuals can call to get referrals to a wide variety of programs and services. Our plan includes information about lessons learned in our ongoing response to the COVID-19 pandemic. We are working with the state, and just recently the federal government also proposed updates to service standards for many of our core programs. So we're advocating for increased flexibility at the local level to ensure that our programs and services are able to meet the needs of those we serve. One example of a standard we're working on right now is to allow the Area Agency on Aging 1B's Advisory Council to meet virtually to improve engagement among older adults throughout our region that participate in that advisory body for our organization. We continue to work in a hybrid fashion in our communities, and we are working with our service provider partners to distribute American Rescue Plan Act funds, which are enabling them to purchase equipment and some other one-time investments. In 2024, we'll continue to implement our advocacy strategy to secure increased state and federal support for older adult services, with a special focus on support for the direct care workforce. The shortage of direct care workers continues to be a critical concern for all in-home service programs. We're also increasing our advocacy efforts to support the Long-Term Care Ombudsman Program, which has been chronically underfunded in the state. That's a program that provides support to individuals living in licensed long-term care facilities, such as nursing homes. We continue to work on modernizing our programs and services to support older adults aging in place in the community. We recently republished our award-winning Connect resource guide, which includes many articles of interest to older adults and family caregivers and county-by-county resource guides. That's available on our website, aaa1b.org/connect. And on that site, there's also a form that you can submit to have those mailed directly to you. So if any of you have events coming up where you want to distribute those or even include it in a newsletter or the like, that's something that publication can support. And we continue to complete trainings for our staff and robust data collection to make sure our programs are available and welcoming to all, with a focus on diversity, equity, and inclusion. So I'd like to close by thanking this board for your leadership on senior issues. We've really appreciated your leadership and partnership on work we've been able to do together, such as the blueprint, the relaunching of the SAVE task force in the last year has been a great accomplishment, and of course the Social Isolation Lifeline project. And with that, thank you for the opportunity to present today, and I'd be open to answering any questions you may have.
Thank you. Commissioner Gershenson?
Thank you, Katie. Good to see you. This ombudsman, so we can recommend this to people that have issues with nursing homes or?
Absolutely. So the long-term care ombudsmen are specifically trained and they're advocates for resident rights. So if an individual is experiencing a conflict in a licensed long-term care facility, so that's nursing homes, adult foster care, or home for the aged, so AFCs and HFAs, they work in all of those settings. And if someone has a concern about the quality of care, if family members have a concern, you can call our long-term care ombudsman and they can provide support. Unfortunately, the national recommendation for the minimum number of ombudsmen to facility beds is 1 to 2,000. So one ombudsman for every 2,000 licensed beds. In Michigan, we lag far behind that with a statewide average of 1 to every 5,000 beds. And it's even more acute in Region 1B as our population has grown much more rapidly, and that the interstate funding formula for how those funds get dispersed hasn't been updated since 1988. So we're even worse off here. So that's why we are advocating so strongly to increase access to that program.
And how do we get the number? Is it in Connect or?
Yes, and I'll put it in the chat here in a moment. I don't know it off the top of my head, but I can get that for you.
Yeah, because I think we'd like to send that out into our communities. And also, do we get any copies of the Connect? Do the Board of Commissioners get copies of the Connect?
I know we've sent it to a couple of places at the county. I'm looking back at Barbara to see if she's seen it. But we can certainly send boxes wherever you want.
I'm thinking that commissioners might want at least a box. So I don't know how many are in a box, but we were just talking about it today in the senior ad hoc committee that we need more access. So if you could make that arrangement with Patty in terms of numbers, how many we'd need, that would be great.
Absolutely, we can do that. We have distributed them to the senior advisory council members, so they've had access to those, but we can get those directly to the commissioners as well.
Do they get one copy, the senior advisory members? Are they getting one copy?
We gave them bulk, so I think most took several. We mailed them directly to all of the senior centers in the county, because that was one concern that the SAC members had, is that they wanted to get them everywhere, and we didn't really want them hauling all the boxes around. So we mailed all those direct, but they also all have been informed about the ability to order more shipped directly to them.
Okay, very good, thank you.
Commissioner
I see
Fowler?
Taylor just put that number in the chat.
But just to be clear, we're still gonna proceed with trying to see if commissioners would like any, and we disperse them amongst us, correct?
Mm-hmm.
Okay, I just wanted to make sure.
Any other questions? So, Katie, I know part of this addresses the wait list. How do we handle the wait list for services now?
You might have broken up a little bit at the end, so I'll repeat the question and correct me if I'm wrong. You're asking how we handle wait lists for services now?
Yes.
So our state and federal standards mandate that we prioritize services to those in greatest need. So our wait lists are generally not a first come, first serve type method. We evaluate people on a number of factors, including their income level, the amount of existing support they have, the level of functional need that they have, and give them a rating. So those who, have many ADL limitations and are especially low income would be priority to be served. And generally that wait list is for the in-home service program.
Thank you. Commissioner
Just to
Christensen?
follow up, Katie, there was a time when you had a wait list and the Board of Commissioners allocated money to reduce or eliminate that wait list. So where are you? How many people are on the critical needs wait list? And
Yeah, I'll have to follow up to try to get a county specific number. I will say one of our biggest barriers right now to getting people in the in-home service program is the availability of direct care workers, which is a bit of a different situation than several years ago when that investment was made. So even when we are working hard to increase our enrollment, getting home care companies, which we call our vendors, to pick up the cases, that has been a barrier to expansion right now, but I can get you that, I'll work to get you that county specific number.
great, thank you.
All right, anything else? All right, would you prompt the vote, please? Do we have a motion? we need a motion have a motion by Commissioner Nelson, support from Commissioner Gingell.
You have 8 yeas, 0 nays?
All right, thank you, Katie. Thank you, Taylor.
Thank you.
That's approved. Our next items are from the Sheriff's Office. There are 5 items from the Sheriff's Office. The first is memorandum of understanding with Oakland Community Health Network for jail services. The next is acceptance of a high-intensity drug trafficking area grant. The third is an acceptance of from the Michigan State Police for the emergency federal law enforcement assistance. The fourth is an amendment to the law enforcement services agreement with Commerce. And the last is using non-departmental general fund contingency for special signage by the Road Commission for our Dream Cruise. Who would like to make a motion by Commissioner Joliet, support from Commissioner Nelson. So welcome again.
Good morning.
Morning.
Okay, so the first item is basically an MOU just to formalize our mental health services in the jail between the services that are provided by the Sheriff's Office and then the services, and to clarify the services that are provided by Oakland Community Health Network. So there's no budget amendment, no finances tied to this, just a clarification. Okay, we're doing them all. Okay, the next item is our annual grant from HIDA. We were here earlier with the application, now this is the acceptance, so it's the same amount, $132,300. There's no county match required, and it primarily covers overtime for the net investigators, and then there's a small portion for communications.
Thank you.
Okay, the next item is an acceptance of a grant. So it's federal reimbursement, but it comes through the Michigan State Police. It's for just under $37,000, and this is actual overtime reimbursement for the folks that we had that attended the MSU shooting response. The next one is an amendment to the law enforcement services agreement with Commerce. They have requested to change a Deputy 2 position and upgrade it to a patrol investigator to be assigned to a special task force. Okay, and the next one is our annual request. As you know, the Sheriff's Office is required to get a traffic control order from the MDOT for the Woodward Dream Cruise. So we work with the Road Commission, and then the Road Commission is actually the one, they have to put out the signs, all the traffic control signs, so it's a little bit over, it's $12,867.05 is their quote this year. And then obviously we will pay the actual cost once the invoice for overtime comes in.
Thank you. Any comments or questions on the Sheriff's Office recommendation? Commissioner Cavell?
Yeah, about the MOU. Can you talk a little bit more about the service descriptions in it? Because it sounds like there's going to be a lot of stuff coming from OCHN to the jail. And is this new stuff?
No, it's basically clarifying, because they have some other subrecipient agreements with places like Easter Seals. And so this was just to formalize basically what they do. So we have it in writing, so everything. So it just is a kind of a supplement to the current MOU that we have, the financial MOUs that we have, where they pay us for some services. And then, you know, obviously we have some agreements where we pay them for some services. So this was just clarifying.
Okay.
But yeah, it's the same. And obviously the MAP program that we've talked about, expanding that, so this all came out of, you know, kind of discussions with expanding that's when we expanded services to out county inmates, then this just formalizes everything.
Okay, thank you.
Commissioner Joliet?
I have a question about the last item for Road Commission. Does the Dream Cruise contract with the Sheriff's Department, do they fund that? We just fund that? Okay,
Mutual aid.
okay, so,
Mutual
or,
aid for everybody.
okay, all right, that was my only question. And I have one other question, but it's not on this part.
Oh, go ahead.
Okay, just an update, it's my understanding you guys have the contract from, for the SRO officer for Notre Dame?
Yes,
Did you guys just get that?
yes.
Okay, I just wanted to make a
Wait
public.
a minute, say that again.
We are reviewing the contract for Notre Dame SRO.
Okay.
Thank you.
You're welcome.
Any other questions? Commissioner Powell?
I was just gonna say thank you for asking, cause that was on my radar today.
Commissioner
Well,
Gershenson?
and I'll add that it is hopefully gonna be on the agenda at the next meeting, because it's being sent around, it's been reviewed, and
The next board meeting?
next board
Okay,
meeting.
perfect, okay. Thank you.
Hope our parents hear that.
I know.
There was one this morning.
Okay.
Here, so I did tell her that.
All right, anything else? Prompt the vote, please, on Sheriff's Office recommendations.
Cavell?
Yes.
You have 8 yeas, 0 nays.
All right, motion carries, thank you.
Thank you for your support.
Sure. Our next two items are from Health and Human Services, two recommendations, an agreement with Centro Multicultural La Familia, and the second is from Neighborhood and Housing Development, the annual action plan. We'd like to make a motion, and a motion by Commissioner Gershenson, support from Commissioner Gendel. And, welcome, we have 3 people
We
from
do,
our health department.
yes. So I will talk about the first item that's focused on the health division, and then I will let our housing staff talk about the second item.
Introduce your
Oh, okay. So Leanne Stafford, Director of Health and Human Services, and then I will let the 2 individuals beside me.
Hello, Commissioners. Khadijah Walker-Fobbs, Officer of Neighborhood Housing and Development.
And Kyle Hines, Housing Trust Fund Manager for Neighborhood and Housing Development.
And these 2 have been very busy over the last 5 weeks. Are we 5 weeks in?
We're on 5th week.
5th week. So yes, they've really taken the reins and done some amazing things already. So the first ask is for us to enter into a subrecipient agreement with Centro Multicultural La Familia. And this is around our Regional Health Equity Council. So we actually brought a resolution to you a while ago, which the state provided some money, where they really wanted to focus on communities that were impacted unappropriately or, through COVID, and how we can learn from the items that happen. So really focused around Black and brown communities and the partner organizations that support those areas. And so we have a council team that comes together, and we have about 10 different agencies, from hospitals to nonprofits to grassroots, that are really looking at opportunities for us in case another pandemic came around, that we could really focus and offer opportunities there. And so these are $24,000 mini grants that help support their activities. Again, these are grassroots organizations, don't generally have a lot of extra money to help us try to gather this data. And so what they've really focused on is using a single tool to gather social determinants of health data, right, around health, economic status. And so everybody's using the same tool if they're part of this committee. And so this helps them implement that and be able to provide the data about that back to us. This is something that the state is also assisting with. So this is just the agreement to bring them in, pay them the money to help with us, and this goes actually through May of 2024. So,
Thank you.
do you want us to keep going on the second item then too?
Okay. All right, well, we would like to ask the Commissioners for support to submit our application for the Neighborhood and Housing Development 2023 Program Year Annual Action Plan. We would like to submit the application in a total of $11,382,518 to the United States Department of Housing and Urban Development. This application does include our Community Development Block Grant funding, our home program funding, and our emergency solution grant program. It will continue to fund 24 special revenue positions within the division.
Thank you. Any comments or questions on these two items? Seems like we all like these items. All right, prompt the vote, please.
Cavell.
Yes.
8 yeas, 0 nays.
Motion carries. Thank you. Thanks for spending time with us. Thank you. Our next item is from Emergency Management, the Incident Management Team's interlocal agreement template for government entities. I would like to entertain a motion. A motion by Commissioner Gingell, support from Commissioner Jolia. And welcome to Tom Hardesty.
Good morning, Commissioners. Thank you. You might recall back in May, I was before you with the agreement where we took over the incident management team from Mavis 3201, the North Oakland Fire Chiefs Group. In that was also a template agreement for private people to join the incident management team. We had some further things that we need to work through with Corp Counsel on the government agreement template, so that's what we have before you here today. So it's still in conjunction, no changes to the team. This is just so we could have an agreement with other local governments for members of the team.
Thank you. Do all the communities in Oakland County sign this agreement?
All no. Most recently, when it was part of Mavis, there were probably about between 25 and 30 different communities that participated. One of the goals of bringing the incident management team to the county from the North Oakland group was to try to get more communities and more agencies involved.
All right, thank you. Commissioner Cavell?
Yeah, you mentioned this is for government entities and that there could be private participants. Should we expect like a template coming before us about private entities?
That was that template was in the packet when the incident management team was approved for the private. So that one was already approved.
Okay.
So this one is for the government for now.
That one was approved when we switched from Mavis, you're saying?
Yes.
That was part of that. Okay.
That was part of that, yes.
Any other questions or comments? All right, prompt the vote, please.
Cavell.
Yes.
8 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Our last agenda item is a public service recommendation from Children's Village, an amendment to the interlocal agreement with Waterford School District.
Good morning. I'm here today with Lori Strong. And we have an interlocal agreement with the Waterford School District to provide educational services for our kids at Children's Village. That does include summer school. The current interlocal agreement that we've been working from expired on June 30th. We are working on finalizing the full interlocal and we'll be presenting that to the board in August. But right now we're presenting an extension that would cover the summer school services. So the extension would be from 7/1 only until August 15th. Just a little bit about summer school. It runs from 7/5 to 8/1. We have 11 teachers. We have 7 teachers' aides. And in those 18 days, the kids actually get 0.5 credits towards school. So it's very important to the work that we do at the village. We're asking for your approval on the amendment today.
Thank you. I have a motion by Commissioner Nelson, support from Commissioner Joliet. Are there questions regarding the agreement with Waterford School District? Commissioner Cavell?
Yeah. Hi, Heather. I don't really know how this works. So the kids in Children's Village are like in the Waterford School District catchment, right? So
yes.
Tell me more about. I mean, and it also it looks like there's no budget requirement. So how is this paid for? How do these teachers get, what they're due?
So right now, what happens is the Waterford School District provides teachers on site at Children's Village. We're working out the details of the full agreement, but essentially, there's a lot of different pools of money that go into the arrangement with the Waterford School District. But what happens is Oakland County pays a set amount quarterly. It's approximately $61,000 toward the cost of education. What happens is at the end of the school year, essentially, they settle up on the amount of money that is spent. And so in many cases, or some cases, Oakland County will receive funds back. In other cases, Oakland County may owe money. And so when we pay those invoices quarterly, it's kind of an estimated amount. The challenge at Children's Village is the number of kids can ebb and flow. Our census can go up, it can go down, which could greatly impact the number of teachers. We have a wonderful, educational experience for our kids, but it can be very challenging because we don't just have multiple classrooms with multiple grades. You could have, 2 or 3 different grades in one classroom. And so it's hard to predict the needs of the village, which is why it's always an estimated amount. Don't know if that makes sense.
Yeah, okay. And you're saying most of those funds come, that 61,000-ish a quarter comes from where? It ends up coming out of our bank account, yes, but are those?
So the Waterford School District would invoice the county, and then we would provide payment. And then at the end, when the budget is finalized, in some cases, we would owe them and they would owe us. It's impacted by special education funding. In recent years, it's been impacted by COVID funding. A variety of different, they call them buckets of money, go into, the educational costs of the kids. And so once the budget is finalized at the end, that is when it's determined what is owed or what may not be owed. The goal would be obviously to try to, budget things as appropriately as possible so that there's not a lot of money owed at the end. But it depends on our counts and what's going on.
If I can help clarify, Heather, that is out of the Children's Village Fund within Oakland County, the general fund. Part of what Heather said, the settlement is we do get funding through the Department of Education, but that's through Waterford School District, because through the Public Act, where our physical address is on this side of Telegraph, they're required to provide educational services to our residents here. And as Heather has said, that is the same like the student counts through the regular school districts in October and February. That dictates what type of funding comes in through the Michigan Department of Education. And we won't know that until spring of next year, if that's helpful.
Thank you, Lori. That's what I was looking for. Thank you. Yep.
Sorry.
You're good, Heather.
Commissioner Carstensen?
So just to clarify, I understand that the number of children is very flexible and fluctuates, but don't you have to have the teachers on staff? The teachers have to be there?
Yes, but depending on what happens with our numbers, they may have to make adjustments. Right now, our census today, for example, I believe is 87 kids. If that census were to drop maybe to 60 kids, that could potentially impact the number of teachers that are allocated to Children's Village. And if that happens, that would be an adjustment to the budget.
Well, so then what happens to the teacher? They have to go back into the Waterford School District, but they don't really have a class if...
Yes, and I don't necessarily want to speculate on what Waterford does. I do know that has happened, particularly during COVID, and they did reassign some teachers. I don't know all the behind the scenes with that, but they were reassigned to accommodate the needs of the village as well as other schools.
Some of that number count really has more to do with what the final tally will be from the Michigan Department of Education. So in those instances where our population has gone down, but not enough to reassign another teacher, that just means that our portion may have to be a little bit more, just because the Michigan Department of Education is by student count only, and that's mandated across all districts. And it's those school counts that are so important in October and February that's really what some of that settlement is about in spring. It's, not necessarily a teacher losing their position. It has to do with who has to pay for that teacher to be here on campus.
Thank you.
Thank you. Any other questions or comments? Prompt the vote, please. Bell?
Yes.
Yes. Thank you, Heather and Lori. Motion carries.
Thank you.
Thank you.
Our last item is public comment. Is there anyone from the public wishing to comment? Seeing none, public comment is closed. Then I will adjourn this meeting at 11:35. Thanks, everybody.
Jesus.
Whoa, awesome. I did not